Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is tendinitis and how long does it last? Tendinitis, also spelled tendinitis, is inflammation of a tendon resulting in pain, swelling, and the loss of joint function. It is most often caused by repetitive motion injuries but may also be due to an infection or inflammatory disease. The treatment may involve rest, ice application, over-the-counter painkillers, and steroid injections. /r/n/r/n This article explains what tendons are, including the causes and symptoms of tendinitis. It also describes how tendinitis is treated and ways to prevent it. /r/n/r/n Tendons are tough bands of fibrous connective tissues that attach bones to muscles. Like ligaments, which connect bones to other bones, tendons are composed mainly of collagen. /r/n/r/n There are over 400 tendons in the human body. 4 of the most prominent and the ones most vulnerable to injury include /r/n/r/n The most common cause of tendinitis is a repetitive stress injury caused by the overuse of a tendon. These injuries are common with occupations involving manual labor or with athletes or musicians who use certain joints and muscles repetitively. /r/n/r/n Examples of repetitive stress tendon injuries include /r/n/r/n Less commonly, tendinitis can be caused by conditions like /r/n/r/n Tendinitis is characterized by inflammation, the body's natural response to injury, infection, or disease. Symptoms range from mild to severe and can either be acute, sudden, or chronic, persistent, depending on the underlying cause. /r/n/r/n Symptoms of tendinitis include /r/n/r/n If severe or left untreated, tendinitis can worsen, causing a partial tear in the tendon or, in extreme cases, a complete rupture. /r/n/r/n With proper treatment, acute tendinitis caused by overuse will usually resolve within 3 months, although complete recovery can take up to 6 months before you can return to sports. /r/n/r/n Even so, recurrence is common unless changes are made to how you use a joint. If changes are not made, an acute injury like tennis elbow will become chronic and may even lead to a tendon rupture. /r/n/r/n Chronic tendinitis may require ongoing care to manage symptoms and prevent exacerbations, flare-ups. This includes treating or managing the underlying condition like gout or diabetes. /r/n/r/n The treatment of tendinitis is usually conservative. The first step is to treat the acute pain followed by a recovery program to regain joint function and prevent future injury. /r/n/r/n Tendinitis is commonly treated at home with /r/n/r/n Once the acute swelling and pain have eased, you will need to gradually incorporate exercises to rebuild strength and regain the range of motion of the injured joint. /r/n/r/n These may include /r/n/r/n There are times when tendinitis is too severe to be treated at home or the injury turns out to be something more serious, like a tear or rupture. In cases like this, cortisone shots, physical therapy, occupational therapy, or surgery may be needed to treat the condition properly. /r/n/r/n Seek immediate medical care if /r/n/r/n Tendinitis is one condition affecting tendons. When tendinitis is chronic, it is commonly referred to as tendinosis. The degeneration of the tendons due to inflammatory or non-inflammatory conditions is referred to as tendinopathy. /r/n/r/n While the terms tendinitis and tendinosis are sometimes used interchangeably, there are subtle but striking differences. At its heart, tendinosis is accumulated trauma to a tendon. It may be caused by inflammation but it doesn't necessarily involve inflammation. /r/n/r/n Tendinosis can occur when overuse continues without giving the tendon time to heal. When this happens, even tiny movements, such as clicking a mouse or lifting your arm, can cause chronic tenderness and pain. /r/n/r/n tendinosis is also characterized by the loss of collagen, which can increase the risk of re-injury or rupture. /r/n/r/n The distinction between tendinitis and tendinosis is important insofar as the goals and duration of treatment can differ. Tendinosis may require chronic, ongoing management with the aim of preserving rather than restoring joint function. /r/n/r/n Tendinopathy encompasses a wide range of conditions affecting tendons, both inflammatory and non-inflammatory. As with tendinosis, tendinopathy and tendinitis are often used interchangeably. However, tendinopathy doesn't describe inflammation as much as it does the process of tendon deterioration. /r/n/r/n This not only includes deterioration of a tendon by repetitive stress, infection, or disease, but also the degeneration of the tendon by things like /r/n/r/n. As such, tendinitis and tendinosis are subcategories that fall under the umbrella of tendinopathy. /r/n/r/n If you can determine the cause of the tendon injury and make a correction, you can often avoid long-term problems. /r/n/r/n If your pain is from overuse, reduce or stop that activity and find a substitute activity. If the pain is from poor technique or poor ergonomics, consult a coach or trainer for skills training. If you can eliminate the offending factors, you have a much greater likelihood of a full recovery. /r/n/r/n To prevent the return of tendon overuse injuries, athletes should maintain a training schedule that includes varied intensity and duration as well as the type of activity. /r/n/r/n Tendinitis describes tendon inflammation that causes pain, swelling, and loss of joint mobility. It is usually caused by repetitive stress but can also occur due to inflammation caused by conditions like arthritis, diabetes, infection, or gout. Treatment is typically conservative, involving rest, ice application, compression, and OTC painkillers. A physical therapy program can prevent re-injury. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.